So I'm doing a talk today about women, or for women, who have problems with their bladders. So my talk is about all the different sorts of incontinence that you can get, and the main treatments, and things that you can do that are very simple that will help improve your symptoms at home. So you can look at strengthening your pelvic floor by doing pelvic floor exercises. You can look at what you drink, because that has a significant impact on your bladder, and weight loss, lots of little simple things that you can do. Sometimes after big abdominal surgery, so if you have your womb and ovaries removed, it can interfere with your nerves, and that can cause problems with stress incontinence. It can also irritate the bladder, which can cause problems with needing to rush to the toilet and having a little bit less control. I think if people are committed and really want to improve their symptoms and do their pelvic floor exercises regularly, then it can have a significant benefit and really improve symptoms. There are always women who do these exercises religiously but don't always notice a significant improvement. But if that's the case, they can be assessed by a specialist who could then possibly, if it was an option, consider other options, which might be in the form of an operation. But we tend to like to do things conservatively if possible, because usually these ladies are going through chemotherapy or have been through serious big surgery and obviously don't want to have any more surgery unless they really need to. Some women find it really difficult to contract their pelvic floor, which is why if you can't do it very well at home, or you're not sure if you're doing it, I would always advise that you seek advice and proper assessment from a specialist. That would be in the form of a women's health physiotherapist or a clinical nurse specialist, or someone with the correct skills. They can then do an assessment, which usually involves putting a finger into the vagina to assess the pelvic floor, and then it tells you whether or not you're doing the exercises properly. And usually if you are, then symptoms should improve. There are a few women, however, that don't improve with pelvic floor exercises. And depending on what their main symptoms are, we could look at other things to try and improve their continence. Okay, so you can also use intravaginal devices to support the bladder neck if you find it difficult to, if your symptoms haven't improved significantly with the pelvic floor exercises. There are also medications that the nurse or the GP or the consultant can start you on to help relax the bladder, to give you more control if you have to rush to the toilet and don't quite make it. So there are other things that you can do if your pelvic floor exercises don't improve things as significantly as you'd like them to. There are a lot of studies done often by women's health physiotherapists into pelvic floor muscle exercises, and they do show significant benefits and improvement in symptoms.